So Dr. Elliot Montgomery Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in the United States and in Canada, Florida, and virtually, and his research is focused on the complexity of issues related to aging and caregiving. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally. He recently published research in the American Journal of Occupational Therapy, the Journal of Applied Gerontology, and the Journal of Social Services Research. He's been a busy man. And Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving, and she presents annually at international and national conferences. Lucy is a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. On a personal note, Lucy would like you to know that she was a caregiver for her mother for 10 years. And with that, Elliot, Lucy, please take it away.
Thank you, Evelyn, so much. Good morning, everyone, and welcome. You know, what makes our sessions really interesting is when you, the participants, participate and engage and give us your comments and your suggestions and any questions that you have. And that's how we like to kind of go about with our sessions. So welcome, everyone. So let's look at our learning objectives for today. So we are going to be discussing difficult behaviors and how to handle them, define advocacy in the context of patient care, recognize signs of elder abuse and how to help, examine conflict in patient care, and the role of communication. So we have a lot to go over today. So let's start. So what are difficult behaviors, especially when a loved one suffers from any form of dementia? So let's look at some examples of what are difficult behaviors. They can be agitated, mood swings, being forgetful, repeating themselves, aggression, both verbally and physically, mood swings, refusing help with activities of daily living, being sexually aggressive and using inappropriate language, being paranoid or delusional, wandering, sundowning, and many more. I always felt very strongly that there's always a good reason why a person with dementia displays difficult behaviors. You know, it could be for many different reasons. They could be frustrated, depressed, confused, afraid. The key factor is to find out what are the triggers that manifest this behavior. So obviously, when a loved one is behaving in such a manner, it certainly has an impact on caregivers. So let's take a look at that. Caregivers don't know how to respond most of the time, especially if the behavior is completely out of character and unexpected. Caregivers may feel helpless, frustrated, angry, desperate, confused, or hurt. Coping with difficult behaviors can make an already challenging caregiving situation even more complicated. It can, in some cases, lead to verbal or physical abuse on both sides. So, you know, this is a quick kind of a sort of looking at how this affects caregivers. And I'm sure a lot of you have experienced that with your own clients. So let's look at some tips that you can share with your caregivers. If it's a new situation or not, they need to make an appointment with their loved one's doctor as soon as possible. The person may have a new medical problem, such as a urinary tract infection that is affecting them both physically and mentally. They may have started a new medication or even over-the-counter medication that is having a side effect. For example, they can become more confused, they're sleepy, they're not able to walk, it's poor balance. So it's really important to try to understand what triggers the behavior. Are there any patterns? Are there situations that could be avoided? For example, if you notice that when the TV or radio is on and the person becomes more anxious, that could be a trigger. It's very, very important to acknowledge and validate their loved one's frustration, not to argue or confront them. Be patient and supportive. They may be hallucinating and see things that are not there. You want to make them feel safe. Maintain familiar routine as much as possible. It instills a sense of security. Keep things simple with no major changes. You know, it's also so important when a loved one is really behaving in a manner that's difficult to try to distract and redirect the person. So what do I mean by that? It could be as simple as saying, you know what, let's go for a walk. How about having a snack? I really feel like having a cup of tea. Come and join me. A gentle hug. Anything that would kind of take them away and try to distract and redirect. Again, you have to tell them to stay calm, don't reprimand, convey a tone of voice that is reassuring. I know it's not always easy, but arguing and confronting will only escalate the situation. So I'm just wondering, before we move on, are there any questions? Okay, so can anyone share an example of how you have dealt with difficult patients' behavior?
Just press *6 on your phone or unmute yourself on your computer, on your Zoom. We would love to hear from you. So many situations are very, you feel like they're really private and like maybe you haven't done the right thing. So I'm sure folks you don't need to be reluctant to share because no one will know your name unless you do a chat. Okay, I haven't argued with them, but rather joined them in their reality to help them feel safe.
Wow, that's a really good, that makes a lot of sense, especially when I was saying that somebody might be hallucinating and seeing a cat sitting on the couch. If you keep telling them that the cat's not there, it's only escalated. And if you go along with it, as long as the person seems to be okay with that hallucination or delusion. Thank you for that. Are there any other examples that you can share?
Love to hear from everybody.
It's an excellent tactic that Blair shared. It is very helpful often to join people in their perception and validate what they're feeling rather than to try to confront them. Any other examples? All right. Well, we can move right along then. So it's really important to know how to handle difficult patient behaviors. There are also situations that healthcare workers, I think, encounter when working with patients and caregivers. Now, our healthcare systems can sometimes be unhealthy, and that adds to tensions between patients, caregivers, and healthcare workers. From my experience, and I think some of us can share this, simple things like long wait times in clinics or for home care, consecutive appointment cancellations or rescheduling, delays to previous appointments, essentially anything that might have gone wrong in the pathway between the patient and the provider can potentially challenge the interaction that we wind up having with our patients, our caregivers, and with one another as healthcare workers. We can often, I think, be the face of frustration, both for patients and for caregivers, especially when we consider the health status of older adults whose health condition is only deteriorating and not improving, such as the case, for example, with Alzheimer's disease, despite our best efforts to help however we can. Now, many different challenging interactions, I think, occur daily. Now, I teach health profession students, and sometimes I rotate in the clinics with them, so I see a lot of this happening. And these challenging interactions can arise, I think, due to discrepancies that we have in expectations, in perceptions, and communication between the patient, the caregiver, and other healthcare workers. So there are some difficult situations that could arise when a patient or a caregiver for example, this is a very common one, has done research online about their ailments, their symptoms, their disease, and is convinced by their findings of a conclusion, demanding that certain investigations or treatments be prescribed. That is a very common one. And sometimes people then feel like they're not being listened to or heard, which can become frustrating. I'm going to talk a little bit more about medical gaslighting in a bit, which is a very important issue and hot topic right now. But things can also be difficult if, for example, a patient or a caregiver doesn't accept a doctor's diagnosis or counsel. And that's very common if the news is not good. If perhaps their symptoms are affecting their quality of life and there is no diagnosis. This can be very frustrating too. I know a lot of people are experiencing this with long haul COVID, and we still don't know all about that and all of the symptoms. So people are, just not feeling themselves. I was rotating through clinics the other day, and this woman had been losing hair, but there was no other symptom, nothing in her blood work. And these things can be very frustrating. And our frustration can sometimes be lashed out at those around us. So I think it's important just to consider a lot of the issues that happen between interacting with healthcare workers and what goes on within a patient, and we all are patients. So to prevent and resolve challenging interactions, I think we need to be thoughtful right now and as patient as we can be. There's a lot of variability in the development of appropriate communication skills, both among health workers too, which has been a challenge. So a lack of communication training, I think, and this is what I see in healthcare education, is that we don't often focus enough on the importance of communication. It can be the result then of inappropriate choice of words and phrases, perhaps due to assumptions being made about the patient's level of health literacy or understanding of their health, or even of their gender, for example, which is something we'll talk about next week, or their culture, race, or ethnicity. A patient's level of health literacy and understanding of their health is very important when you involve them and include them in their decisions about their treatment options. Sometimes the lack of communication can also lead to a lack of options being offered to the patient and the caregiver, or, as I was mentioning, not involving the patient in the decision-making process to the extent possible, or not even referring the patient to appropriate support, services, or resources. And this is also very true for caregivers. Oftentimes there's a lack of referral. And as Lucy and I were discussing in our first program in this series last week, part of that issue is based in the fact that we first have to define the role of caregivers, if they are our resources, our clients, or our partners. So really communication, I think, is critical. It's also important to break down information into small pieces that are easier for people to understand, especially when we're anxious in healthcare environments. And this is a very important role that caregivers play, is sometimes being the party that is there to digest the information, take notes sometimes. And it's important to consider how you best communicate with whomever is there with you. It could be both the patient and the caregiver. It's also important that you reiterate and confirm halfway through the conversation if everyone is on the same page and understanding everything in the same way. And you can also ask the patient or caregiver to summarize back to you what their understanding was, so that you can help to correct any perceptions that may be askew, for example. This is very important, like I said, when you have a bad news conversation. And we all know that 2 pairs of ears are better than 1, especially when the information being received is not positive or unexpected or difficult to understand. And in those situations, it can be very hard for people to take in that information. I think also nonverbal communication is very important. It's as important, I think, as the actual words a healthcare worker or perhaps someone around may be using. So body posture, gestures, eye contact, these all combine with verbal communication to facilitate a meaningful and positive communication with the caregiver and the patient. Also ask for their names if you don't know them, for example, of the caregiver, and speak to them, tell them their name. Very reassuring, and it helps to engage in dialogue rather than one-way communication. Now, I think this is true now more than ever since COVID. Also, as we're hearing about monkeypox, but healthcare makes people anxious. And more research has been coming out about how COVID has actually made people much more anxious about receiving healthcare and more anxious about their health overall. So again, think about that. Think about yourself, how you are in healthcare situations. Remember that people may not take in all the information, and so it might be important for you to have some notes written down or something to give people. Resources are very important to give people. Also look for signs of distress. For example, when patients are very anxious or caregivers, they may increase in speech and become very hyper. If you notice that they're anxious, there are things that you can do to help. They're very similar to what Lucy was saying: divert, distract, and occupy. I was once in a medical practice and I was extremely anxious, and the nurse started asking me what I had for dinner the night before and what I had for breakfast and what I was planning to have for dinner and what I was having for lunch. And I thought she was just really food obsessed, but she was distracting me, and it was really actually very helpful. So it's also helpful, I think, to build connections and to find common ground, to reassure the patient that they can feel safe and that they can communicate openly with you. You need to establish trust. And it's important to help patients and caregivers also get some sense of emotional control. And that's again where those resources come in and are so helpful. Feeling helpless and hopeless is a common challenge, I think, encountered by patients and by caregivers who are facing a difficult health diagnosis. So imagine being a patient yourself. Not being in control can trigger negative emotions and can also make communication difficult. And this is where effective and empathetic listening are so important. We all need to have our listening ears on and hear what people's concerns are. It's the best way, I think, to help support patients and caregivers in navigating through some difficult situations.
Thank you for that, Elliot. That's really a lot of very good information. Communication is really key. Are there any comments or any questions before we move forward?
Love to hear from you, folks. All you have to do is press *6 if you're on the phone, or unmute yourself if you're on Zoom. You know, the direct, redirect, occupy, your 3 words, they're great. But I think the other thing too that seems really important to me is know your own emotions. Because if you come in a room and you're upset about something and you go and you're trying to deal with someone who has cognitive deficits, they feel your emotions. They may not hear you, they may not know what you're saying, but they feel how you feel. And so it's so important to, before you go in that room, know how you're feeling. Say, okay, that's how I'm feeling, but that's not how I'm going to show it. I need to show something else. I need to show that what Elliot just talked about, that sense of being in control, that everything's okay, that the world is going to be fine.
Energy is very important, and people feel that.
Excellent point.
Anybody else? Come on, share with us. Sure, you've been through some rough times.
Okay, we'll give people a chance to kind of absorb what we're saying. All right, we're getting on a topic that's really difficult. And before we started, Evelyn, I really appreciated what you said. Elder abuse is a very uncomfortable situation to be in, especially when you're a healthcare worker, because there's a lot at stake. You could be reporting something that's not a fact necessarily, or you're not reporting, and then something really bad can happen. But I think this is going to give you a pretty good indication. Elliot will then go on and explain a little bit more about reporting. So let's take a look at what is elder, the definition of elder abuse. Okay, so one, it's the physical abuse, inflicting pain or injury, such as slapping, hitting, bruising, restraining. It can also include inflicting medication tampering, giving too much or withholding medication. Then we have another one that's called sexual abuse, any non-consensual sexual contact, whether comprehended or not. And then we look at emotional abuse, inflicting mental anguish or distress through verbal or nonverbal acts of threatening, intimidating, or humiliating. That happens a lot, and it's certainly abusive. Neglect abuse. It could also be self-neglect, which needs to be reported too. Failure to provide food, clothing, shelter, healthcare, or protection. And then there is the financial abuse, illegal use, misuse, or concealment of funds, property, assets, or benefits for someone else's gain. We see a lot of financial abuse. And then there's the abandonment abuse, desertion of a vulnerable adult. So there are lots of signs. I mentioned a few of them, but let's go over a little bit more. So there could be bruising, cuts, abrasion, burns, and other physical signs of trauma. The person can become more confused or depressed or suddenly socially withdrawing. Seniors' financial situation really is changes. You have to also look at bed sores, poor hygiene, and weight loss, unexpected negative reaction to physical contact. They're afraid to be touched, unexplained venereal diseases or injury to private areas, self-doubt or unwillingness to speak. So a lot of these things we really have to watch out for, and we really need to be conscious. But I also want to note, if you notice any of these signs, you need to ask the caregiver what has happened. Don't blame, don't be judgmental, but get the facts. You may need to report your findings. You know, for example, if you see a lot of bruising on the care receiver and the loved one, it's possible that their medication was changed, and they could be on blood thinners, which will make you bruise very easily. So, but knowing that, it's still important to ask. As well, to keep in mind that the loved one may be abusing the caregiver. If you see any signs of abuse on the caregiver, you need to gently find out what's going on. You know, sometimes caregivers are reluctant or embarrassed to actually tell you, especially in financial situations where their child, their adult children or grandchildren are really taking advantage of them financially, and they're afraid that these people might get into trouble. So even though it's a very, very delicate situation that healthcare workers find themselves in, it's extremely important to be aware of it. And one of the things that is so important is for you to know what to do about it. So I'm going to kind of leave it up to Elliot to kind of move forward in this discussion, and then hopefully open it up later for you to share with us as well.
Well, I had mentioned that I was going to talk a little bit about medical gaslighting, and that is something that to me is very closely related to elder abuse, much in the sense that we were talking about neglect and talking about ignoring signs and symptoms. And sometimes if a provider does not listen to your health or your health concerns or downplays it, that can be a sign of medical gaslighting. And the reason I bring this up is that it is more common in geriatric settings. It's something that's gotten attention certainly much more recently, but there is a role that healthcare workers can play in helping to minimize what I consider to be the abuse of medical gaslighting. If you're a PA or a health assistant, any role that you play in the healthcare dynamic, you can certainly help to bridge communication and help to make patients and caregivers feel like their concerns are being heard. A lot of people have asked in the past what to do if you feel like your doctor is not listening to you. And though it is not the path of least resistance by any means, finding a different provider can be a very good option. And it's one that a lot of the research and practice is also saying it can be helpful, because it's very difficult to change a provider's method of communication or perception of what your symptoms might be. And so I wanted to make this point known in the context of elder abuse because it is more common in geriatric settings where seniors tend to get their concerns dismissed. I wanted to know if anyone had any questions or anything that they wanted to discuss in this context.
Just press *6 if you're on the phone, unmute yourself if you're on Zoom. We very much would like to hear from you. You know, Elliot, I don't know what the national statistics are, but in San Diego, when I was working with the Adult Protective Service Program, 85% of elder abuse was financial. It was amazing.
I think that we're still seeing that, especially with calls that people receive, scamming for money. I have a cousin who is 91 and she called me the other day very concerned because she got a robocall about a credit card charge from Amazon for $1,093. And it said, you know, to press 1 if you did not make this charge. But she knew well enough to just hang up the phone. And by pressing 1, she would have been connected to a scammer of some kind. So there's a lot of financial abuse that's going on, I think both by family members, people who know people, but also externally.
Right.
Absolutely, yeah.
Anybody else have a question? We have experts. Ashley.
Hi, good morning.
Good morning.
I'm a social worker. I'm out of Florida, and it's funny that we're talking about financial exploitation because I actually had a patient. Actually, I'm a couple last week, and we had to call and make a report. And in this particular situation, the daughter who is from out of town has been in town for about 2 months caring for her parents, and expressed this concern that a neighbor was financially exploiting her parents, where her mother was giving this woman thousands of dollars to help pay for her, taxes or something like that. And, I'm listening to this daughter, and what I did was I encouraged her. I said, I'll support you and we can call together, because she was there, and had been kind of witnessing the relationship with the neighbor. So we called Adult Protective Services together. And they did accept the case and things like that. So I think kind of supporting caregivers and, with them having firsthand knowledge a lot of times is helpful as well.
I think just by doing that, you were so helpful, because as I was saying, sometimes it's difficult even for a family member to report, especially if it's a neighbor. You fight. So good for you. That's really being an advocate for your client, which I'll be talking a little bit more about that a little bit later. I also saw that I think Blair made a little bit of a comment.
Yes, and I will read it. Blair said, "We have all seen all sorts of elder abuse with those we've served. The financial abuse aspect is so upsetting, especially when it involves a family member. We had a client whose son forged their signatures on documents and sold their home right out from under them. It's just awful." Yes, it is. And we're going to talk a little bit about how to report. But I wanted very much to touch upon the issue of medical gaslighting. It's not something we've discussed before in the context of elder abuse, but it's something that's gaining a lot more attention in the medical community. And also, research is showing that healthcare is not serving everyone equally. For example, women and people of color and geriatric patients and LGBTQ patients are more likely to be misdiagnosed with certain conditions. They'll often also wait longer for diagnoses. So these are important issues, and we'll talk more about that too next week as we talk about the role of culture in caregiving. But moving forward, So how do we go about reporting abuse? Now, the impact that healthcare professionals have in recognizing and reporting abuse is profound, but healthcare workers have different perspectives on their role in the detection and reporting. In a bunch of different research studies, nurses tended to perceive elder abuse as uncommon and generally did not feel it was their role to assess patients for potential abuse. Rather, they relied upon physicians to detect and report. But physicians, interestingly, felt that other patient care issues, and especially time limitations, also maintaining trust in the clinician-patient relationship, outweighed the importance of detecting and pursuing suspected cases of elder abuse. They relied, the physicians, on social workers to approach these issues with patients. Social workers, although having the most knowledge and experience related to elder abuse of the doctors and the nurses that I described, of the three groups, they relied upon nurses and physicians to detect potential abuse situations and to work with them in making appropriate referrals. So all to say, all groups acknowledged the need for more and better education about elder abuse detection and reporting. And something not acknowledged, but I think really critical as part of this whole dynamic, is time. If you think about it, the average primary care appointment in 2021, so we're talking very fresh statistics, 18 minutes long in total. So it's very hard to tackle everything and have candid conversations in such a short period of time. So if you do suspect abuse and you do want to know how to report it, the first thing, obviously, that we know is that if anyone is in immediate danger, to call for emergency support. But if the danger is not immediate, and this is often the case with elder abuse, but you suspect that the abuse has been occurring, tell someone. It's very important to find out what the protocol is within your specific agency or organization, and also if there are tools for assessment of abuse or an internal protocol to follow. So for all you healthcare workers out there, find out what your organization's protocol is. Relay your concerns to Adult Protective Services, just as one of our participants shared. There's also the long-term care ombudsman that we'll talk a bit more about, and again, the police. You can also reach the elder care locator, and through them, you can find the ombudsman in your local county or area by calling 1-800-677-1116. They do have specifically trained operators to help refer you, and the elder care locator is open Monday through Friday. But if you want to reach them after hours, the other suggestion I have is always 211. They can always connect you with people that you might need to speak with. We're going to be sharing some very important links and resources as always after our program today as well. But please do make a practice, find out now if you're not sure what it is, what is the protocol in your agency or organization. And again, we'll be sharing these specific resources after our program. Does anyone have any other questions or comments before we move forward?
Just press *6 if you're on the phone, unmute yourself if you're on Zoom. This little website, I can see who's doing that and can call upon you. I'd love to hear from you.
I'm also curious if anyone has felt like they've had the experience of medical gaslighting and how they've dealt with it. Again, it's something that hasn't really gained much attention until recently.
You know, it's interesting, Elliot, I hear a lot of young people using that, talking about their relationships, saying, my boyfriend is gaslighting me. So what actually does it mean?
Good question.
That's a great question. So gaslighting means that you are made to feel something that you're not feeling or experiencing, or made to believe something that is different from what your experience is. So in the case of medical gaslighting, for example, you can go to the doctor and report certain symptoms, and they'll say, you know, nothing seems to come up. You had blood work recently. You know, maybe you need to seek mental health counseling. But if a referral is not made to help you connect with a mental health counselor, where you could actually receive treatment, then that would be a good example of medical gaslighting. We've talked in our program before, and I go back to the show, The Golden Girls, because they addressed this in one of their episodes in the show decades ago. One of the characters was suffering from chronic fatigue and swollen lymph nodes and glands and just not feeling functional. And she had gone to see a number of different doctors who said that she was having a midlife crisis, perhaps to color her hair or change her workout routine or go out dating. And that was brought to television because of the experiences of older women. And I think it's a very important issue for us to speak about, because it is happening more and more where people are not getting the proper diagnosis or the attention that really they should be receiving based upon what they're feeling, what their test results might be. And it's something that we need to be more attuned to.
So it's like somebody making up your reality.
Correct, exactly.
Okay.
Or someone dismissing what your experience is. So if you're feeling nauseous every day and someone says there's nothing wrong with you, that's an example of medical gaslighting. Lucy, I'm sorry, go ahead.
No, it's okay. And then Blair also wrote again. Yes, I think you're making a very important point, because many times the symptoms are blamed on mental illness. They're blamed, oh, you must be depressed, as you were saying with the Golden Girls, or whatever, you're in menopause if it's a woman, or the man maybe just retired, so you're depressed because you're retired. This is really, it's really very important to keep that in mind, because unfortunately in the healthcare system, there's a lot of ageism as people age. And I know that from doing my own master's research on that in healthcare professionals. And so it is important to really be aware of that. I also, because I sort of noticed what you had written, that your provider will, they're sort of being condescending or belittling you or being rude. These are things that you really have to keep in mind.
Blair wrote, on a personal level, I have, and I didn't realize that at the time that's what it was. But looking back at it, it was that. My mother-in-law had cancer, diagnosed at the beginning of 2019, and she ended up passing away 6 months later. And the doctor didn't diagnose it until she ended up in the ER. The doctor kept telling her it was depression or chronic fatigue syndrome, which was actually the diagnosis of the character from the Golden Girls, chronic fatigue syndrome. But Blair, I'm so sorry for that experience. And I think it is more common than people recognize. And it is common among seniors and among women. Similarly to what you shared, Blair, I remember when my mom first found a lump in her breast, and she had gone for her mammogram and it was fine. And she insisted upon a biopsy, and the cells came back irregular, but nothing suspicious. So they were just going to keep an eye on it. And she insisted to her doctor that they do a deeper biopsy. And on the third biopsy, upon her insistence, they found cancerous cells. So it really was because of her own persistence that she wound up having a very positive outcome of her breast cancer experience many years ago. But I just think that it's something that we need to be more aware of. And I think especially people of color, women, older people, to me, it signals elder abuse. And I thought it was very important when we speak of seniors that we brought this into the conversation, because it is happening and we need to be more aware of it, I think, as healthcare workers, but also as patients, because healthcare workers can really help to bridge that gap, or to say to that provider, I think there might be something more there. I spent some time with the patient.
I think there was something by Lisa, if I'm not mistaken.
She was able to get on Zoom. Did you want to talk to us, Lisa?
Okay. just very quickly, you're so right. In the beginning of my career, when I was a frontline worker, went to see a couple who were seemed fine. She wanted assistance with bathing, and house was fine. They seemed to get along. The husband had very severe dementia, but I felt that something was not just right. As she walked me to the door, she turned around to me and she said, "My husband is raping me every night." And at that point, I was so taken aback. We're talking about many, many, many years ago, when that whole notion of elder abuse was not even discussed yet. So, I did take the time so my gut told me. So, as healthcare workers, your gut tells you a lot many times. And it's so important to take that extra time to really find out what's going on.
Well, I think, Lucy, that's an excellent segue into talking about advocacy.
Yes, advocacy. One of the most important roles that healthcare workers have is to advocate for their clients, their caregivers, and for themselves. I really believe that we need to advocate for ourselves as well. So let's look at what is advocacy. It's defined as any action that speaks in favor of, recommends, argues for a case, supports or defends or pleads on behalf of others. So when healthcare workers advocate, they ensure that their clients and their caregivers are able to have their voices heard on issues that are important to them, protect and promote their rights, have their views and wishes genuinely considered when decisions are made about their lives, help navigate unfamiliar circumstances or difficult transitions, as are the person who said about, calling to report on elder abuse. That's exactly what advocacy is all about. Advocacy is part of changing service delivery to meet the specific needs of individuals, as well as speaking out for those who cannot speak for themselves. So I do believe that healthcare workers really need to advocate for themselves as well. When you advocate, you don't just come up with problems. I think it's important to keep in mind that if you feel something isn't right, come with the problem, but also come with solutions. Many times we need to question our own practice and service delivery. Otherwise, nothing changes for the good. So if we're doing the same thing over and over again, but somehow it's just not fitting, that's the time to question service delivery, to question. It's not easy to do so, but if you can identify certain things, it will help in the end if you do advocate on behalf. So let me go back to 1992. That's a long time ago.
We weren't born, were we, Elliot?
I was born, I was working. Okay, so now you kind of sort of have a good impression of how long I've been in the healthcare service. But really going back to the 90s, I started recognizing, I was in charge of a home care service department, that a lot of the clients were elderly women that were caring for their husbands. And things were coming up. We didn't call it caregivers at the time, but the healthcare workers felt that these women, mostly women, these elderly women, needed help. They weren't really taking care of themselves. And so we decided to do something about it, is to try and do a survey and see how difficult was it for them to care for their husbands. And sure enough, we changed services and developed the caregiver support center with different services attached to it. So again, it doesn't have to be earth-shattering. If you see something is not working, or even a certain clientele that are part of the new services that the services are not meeting their needs. So an advocate, you need to know what services are available to your client. And I think you also need to know what resources are. So can anyone share an example of how you advocated for your client, your patient or caregiver, and what were the results? And I'm sure a lot of you have done that, but I'd love to hear from you.
Come on, folks. Okay, Lori, go.
Hi. I worked in the hospital system for a lot of years, and I dealt with the medical gaslighting on a personal level, but also on a professional level. You know, and a lot of times the doctors themselves, other staff members would treat people differently depending on their skin color, also depending on whether or not they had private insurance or if they had Medicaid or no insurance at all, which I didn't like. But so a lot of times I can definitely share a lot of different experiences from that. But I do recall a time where we had a patient that had Medicaid, and they don't pay as well, you know, on the rehabilitation floor, but you're required to get 3 hours of therapy 5 out of 7 days a week. We tell them that when they first come in, but a lot of times people don't remember. And when you schedule them, they were skipping the Medicaid patients therapy sessions, you know, give them 1 or 2 here and there. And then they were ready to discharge them. And, you know, everybody was on board to discharge. I had to say something, you know, that we were not doing them justice, and it was not fair to discharge them without giving them the right amount of therapy that they deserve. She didn't even have a chance to get the improvement she needed because we did not do our jobs. And, you know, the faces were like, you're right. You're right. So we were able to keep them longer. And I tell you, but you could tell it was a little bit of they didn't care for it too much, because after about 2 more weeks of them not improving, they said, so what do you think now? Well, we can discharge them now because we have done our job. You know, she did not improve, but it wasn't because we were cheating her out of what she deserved. So that was my thing, that, you know, we need to give her the same therapy that everybody else is getting. You know, just because she had Medicaid does not mean that, you know, her time should be cheated, you know. And I had to do the insurance updates to the private insurances. And of course, Medicare, they check those. So they didn't check the Medicaid, but that still wasn't right. So, and I felt like I not only advocated for the patient at that time and their family, but also for myself as far as not accepting, you know, what was going on, because that's not what I went into the field of social work for. You know, you went to help people, but to just sit there and not say anything, you know, I wasn't advocating for myself, not for the patient or anybody. So definitely did not do that at that particular time. And, you know, and other times after that, and, you know, and they had a little sit down with me. Well, I mean, I know it's a business, but at the same time, you know, we're in a business of caring for people, and we should not accept people if we're not able to provide the service. Let somebody else take on that responsibility.
Great example. Great example, Lori. Thank
Good for
you.
you. Yes,
Thank
good for you.
Lori, I want to applaud you, and I want to thank you for your advocacy, but also for reaffirming that this is not just for the patients, it's for ourselves. Often we remind our healthcare workers that we all took professional oaths, and whatever they were, they may not have been to first do no harm. We didn't all take the Hippocratic oath. They were all to help people feel and get better. And we play an integral role in that. So thank you for advocating. With such an
Anybody else?
excellent
Thank you.
example. I'm sensitive to time. We will be sharing our slides with everyone. So if I don't cover all of this in full detail, know that you will get a copy. But we really just wanted to remind everyone that there are state-based resources. Every state has an aging services division, and they are dedicated really to providing elders with community-based services so that they can stay in independent as long as possible. Local area agencies on aging are certainly an amazing resource and point of contact whenever elder abuse or neglect is a concern. So know that as well, and the link at the top of your screen can take you to your local area agencies on aging. It's also important that everyone knows their rights. Now, in all long-term care settings, in a highly visible area, there should be contact information for your local ombudsman. And that ombudsman is there to assist and support and advocate on behalf of patients and caregivers and also healthcare workers in a neutral way. And they are a neutral party as well, though they are provided through your state. They're there to mediate. So please make sure that that information is in your long-term care facility, but you can also find your local long-term care ombudsman through the link below or the number 1-800-677-1116. Now, additional resources you can find through the National Center on Elder Abuse. There are actually some tools that Lucy and I had worked on and created back in Quebec that I know are part of their clearinghouse on instruments for detecting elder abuse. And you can certainly find additional information there. And finally, we have all of our resources here for you. And like I said, we'll be sharing a copy of our presentation. But we certainly hope that you'll join us next week. We're going to talk more about culture, diversity, gender, sexuality, which I think is very much connected to all of the things we've talked about today. Thank you.
I'd just like to add, for those of you who don't know about your area agency on aging yet, that there are 365 of them across the country. Every place has an area agency on aging. They all have a caregiver specialist, which has been funded by the federal government. So please get the number of your local, what we call AAA, and that's not the auto club, and find out, what the number is and call whenever you need something for caregiver services, for nursing home ombudsman, for senior legal services. There's so much that they have to offer there. With that, let me just close up, do a little housekeeping here and let you know that you will get the resources if you are registered today. And if you're not registered, if you got the number from somebody else, please get registered. And you can do that by calling our customer service person at 866-390-6491, top of your screen there, and get registered. And when you do that, you're not only going to get the resources, you're going to get the great monthly calendar. I'm going to tell you about a couple of things that are on the calendar besides the diversity and caregiving with Elliot and Lucy next week, next Wednesday. We have on Thursday, tomorrow, Lucy is going to talk about how music can help people with dementia. That would be really fun listening to do. Can't wait. On Thursday, August 25th, we're going to have high conflict relationships and its impact on you as a caregiver. And for those of you who have issues with family members on how to provide care, how to deal with property, all of those very difficult issues, that should be a good one. Friday, August 26th, we have Food is Medicine, and it's in Spanish. And what they're going to talk about is how you can help your own chronic illness with your diet. So that'll be really important. Tuesday, August 30th, we're going to have one about dementia and the hidden patient. And this is about how all the feelings of Alzheimer's patients don't get expressed and how we might be able to try to find out about those. So we have a lot of really good stuff lined up. With that, I want to thank all of you for participating. Thank you so much for what you do. You're the backbone of long-term care, not only in the US, but in the world. Elliot gave us some research one time on how many caregivers there are in the world, and it's a huge number. It's a huge number. I mean, what is it? 76% of the care is provided by family caregivers or something around there, Elliot.
And we know that that's underreported.
Right. Absolutely.
Whatever the statistic is.
Right. Okay. So the other thing I would like to say is to thank the Well Men Charitable Foundation. for the caregiver teleconnection and for the wonderful information and education it brings to caregivers and their loved ones and the impact that it has on our community. So it's been great to be able to be part of this community. So thank you all. I'm going to stop the recording now. Can't tell you how much we appreciate you joining us today.
Thank you, everybody. Be well and keep on advocating.